Faculty of Medicine of University of Pristina. Pristina is the leading medical education provider in Kosovo, and it was the first to begin a bachelor's study program of nursing in 2001. Department of Nursing, recognized as a leader in the preparation of nurses in our country, occupies the first floor of Institute B located at the University Clinical Center of Kosovo, in Pristina, Republic of Kosovo. E-Lab is designed to integrate modern technologies aimed at facilitating medical education. In this regard, use of education-based software, e-learning and distant education modules was made possible. Some of the benefits expected from E-Lab located at the Department of Nursing are opportunity to use various software which will ultimately assist students' teaching and hence academic performance, ability to better measure learning activities, ability to deliver more interactive study materials, effective and easy access to various databases, facilitation of collaboration with other international universities and academics. The anatomage table, or the virtual anatomy dissection table, is the most technologically advanced 3D anatomy visualization system for anatomy education is available at our institution. It allows students to interact with young and well-preserved digital cadavers instead of aged and degenerated bodies. The table allows for exploration and learning of human anatomy beyond what any cadaver could offer. Center for Simulation and Clinical Skills Development, established on January 2018, is the first of its kind in a higher education institution in Kosovo. Center for Simulation and Clinical Skills Development consists of 5 labs or cabinets equipped with sophisticated multifunctional equipment and other expendable materials, including high advanced mannequins that can be used for simulation and exercises on surgery, internal medicine, nursing care, reanimation, gynecology and obstetrics and pediatrics, just to name a few. The transition from the academic settings into healthcare settings remains stressful for the students, and they can suffer from initial clinical anxiety due to several reasons. The differences in environments, the fear of making mistakes, issues in working relationship with either healthcare practitioners or patients, ambiguity of their role and responsibilities in a healthcare setting, and performance expectations. The center facilitates the teaching and learning of a variety of clinical skills, thus filling the gap between theory and clinical practice. By simulating realistic environment before practicing invasive and non-invasive procedures in real patients, the center improves the students' performance, increases their level of confidence, and improves patient safety and welfare. Nursing program of Faculty of Medicine of University of Pristina pays special attention in the practical part of the study that consists of clinical exercises and clinical practice. Clinical exercises are conducted with 8 to 10 students in simulated conditions in modern equipped cabinets for practicing nursing training. During clinical exercises, students ask questions about their clinical learning activities, seek clarification and share concerns with their teachers or supervisors. An important role of the teacher or supervisor during clinical exercises is to ensure that students have essential knowledge and competencies to complete their nursing activities in real clinical settings. In many instances, the teacher or supervisor needs to instruct students further and fill in the gaps in students' learning. The academic staff of Faculty of Medicine is employed at University Clinical Center and National Institute of Public Health, and all students of Faculty of Medicine, including the nursing students, can use the infrastructure of clinics and practical clinical units during their classes. Through clinical practice, students get acquainted with different areas of nursing, and through these practices, they get the first idea of where they would like to work after graduation. Clinical practice is supervised by the clinical mentor or supervisor. Students in the first year start practice in the primary level outpatient clinics, while in the second year they continue in the secondary level hospitals, and in the third year in the tertiary level at the University Clinical Center of Kosovo. Nursing students from the University of Pristina participate in the health holidays activities, assisting in glucose screenings, blood pressure and weight checks, as well as educational stations about preventing diabetes, hypertension, obesity, etc. Thank you very much for your attention.